Alzheimer's. Advances are being made every day against this debilitating disease. But we're still so far.
The notion that this is simply a science problem is wrong. This is a societal problem of greater magnitude.
The Davos Alzheimer's Collaborative, DAC, is solving that problem. DAC is responding to the size and scope of the dementia issue by tackling the need to link and scale globally and across sectors the disjointed and underscaled nature of the current response.
An organization initiated by the World Economic Forum to increase and speed neuroscience research globally.
DAC is diversifying Alzheimer's research and expanding the front lines of Alzheimer's care worldwide.
You can't think of the low and middle income countries as an afterthought. So we're building in the collaboration in those countries from the get-go.
DAC is bringing Alzheimer's research to places and populations it has never been before through 22 cohorts in 16 countries.
The challenge, of course, has been that so far, most of the genetic and genomic data in Alzheimer's, more than 90% of it, has been generated from a very small set of the population, which is not representative of the world. We are developing global cohorts in Alzheimer's and really understand Alzheimer's as a function of race, ethnicity, and geographies.
DAC is finding people who were previously invisible to Alzheimer's research. In places like Kenya, through partnership with the Aga Khan University Brain and Mind Institute, and the Rio Grande Valley, reaching populations who have not been part of clinical trials before. DAC is not just leading the conversation around diversity in Alzheimer's research. DAC is making that change happen.
How impactful is this?
I think it's game-changing. I think that we're finally onto a path in which we can start doing research that's going to include everybody in a way that we haven't before. And I think it's going to revolutionize what we think we know.
To prepare our health systems, DAC is orchestrating 19 projects around the world aimed at detecting Alzheimer's earlier. In East Africa, DAC grantees are working with local community health workers to deploy cognitive assessments to older adults at risk. In Armenia, DAC has transformed vans into mobile clinics, reaching remote areas with brain health education and cognitive screening. In Brunei, DAC grantees are partnering with senior centers and village heads to engage communities and end the stigma surrounding Alzheimer's and dementia. From Indiana to Florida to Mexico and Jamaica and beyond, healthcare systems around the world are learning everything they can about early detection and aiming for policy change. DAC has steered 12 grants focused on technology that will expand the front lines of Alzheimer's care, from the use of cutting-edge methods detecting Alzheimer's through retinal scans, to the use of digital cognitive assessments that foreground cultural sensitivity and accessibility.
Every country, every context is very different. It should be culturally tested, acceptable, and embedded within the health information systems.
DAC is connecting the dots on the ground to inspire health systems with the sense that they can do this. And together with the Global Alzheimer's Platform, DAC is building a global clinical trial network around the world.
I'm very encouraged by the work that DAC does, setting up a framework, for instance, for conducting research, for understanding what infrastructure are available is really important.
We're the closest we've ever been, but now is when we need support from private and public sources, philanthropists, governments, and global health leaders.
There's a reason that we name this the collaborative, and that is because none of us can do this alone.
The Davos Alzheimer's Collaborative began at Davos with a mission to solve inequities in detection, diagnosis, and access to interventions and care. We've made progress on that promise, and now we're here with a robust global effort underway.
No one company can solve this, no one government can solve this, no one academic researcher can solve this. So it's going to be a team sport to beat this sucker.
Help us end Alzheimer's disease everywhere.